I'm Brian Shaw. I'm the Certified Diabetes Educator here at Sacramento Native American Health Center. That means I talk to patients about what diabetes is, I help them understand how to live a healthy life, and I teach them how to manage their diabetes in different ways. Today we're going to talk about lancing your finger in preparation to measure your blood sugar with a blood glucose monitor. Checking your blood sugar is a very important thing to do if you have diabetes, and the only way currently we can do it, the easiest way, is to get blood from your finger through what's called lancing. Lancing just literally means getting blood from your finger by either poking it or slicing it. Most people think of it using a device just to poke their finger. So today we're going to show you the proper demonstration, the proper way of doing that with a lancing device using all of this equipment that I have here. The first step in getting your hand ready to lance your finger to draw blood is to use the right equipment. Right here in front of us we have several different devices. We have what's called a lancing device. You've probably heard it. Most of them look very similar. It's basically a plastic device. You pull the cap off of it and you put what's called a lancet inside of the device. And we'll talk about how to load it in a second. So we've got the lancing device. We've got lancets. They all are basically universal, which means that they all will fit in all the lancing devices to some degree or another. Some are a little bit different, but most of them are either blue or multicolored, and they will all fit most of these devices. You probably have a lancing device that looks similar to one of these, and you probably have received lancets that look similar to this. It's basically a needle underneath the cap. You load it inside the lancing device, and you get ready to poke your finger. The other things you need to lance your finger properly are probably cotton balls or tissue if you have it, an alcohol swab or to make sure you have soap and water to clean your hands, or Kleenex to wipe off the first drop of blood, and a sharps container to put the lancet in when you're finished using it. So the first thing we're going to do is we're going to prepare the lancet with the lancing device and show you exactly how that works. I'm going to choose this one. This lancing device has a cap that you pull off of it, and you can see that there is a place to put the lancet within the inside of the lancing device. You take the lancet, you push it all the way to the bottom so that you can't push it any further, and you notice that it is spring loaded. One of the most important aspects of this is that it is spring loaded so that when you're ready to poke yourself, the pin goes further up and pokes your actual finger. So you can see this is spring loaded. I wouldn't pull the cap off yet first, but you can see if you somehow unnecessarily cause the lancing device to have the spring poke toward you, you can just put it back in that direction. You'll also see that there's a button here. The button activates the spring loading mechanism. And then we have the cap here. So the first thing to do is once the lancet is inside the lancing device and the lancet is pushed all the way to the bottom, then you can peel off the top of the lancet. And you put it aside because as you see, it will cover it back up when you're finished. Now you've got the lancet with the needle poking out, you've got it spring loaded, and you've got the cap that you put back on until it clicks. Now it's ready to go. If for some reason you inadvertently push the button, most lancing devices will allow you to pull back on the end to reload it again, and you're ready to go. If you notice, most of these have numbers at the top. What do you think the numbers are for? Everybody always wants to know, what are the numbers for? Well, if you look at the numbers, usually have a dot associated with them. And the dot is the size of blood that you will likely draw when you poke your finger. And usually the smallest number is the smallest drop. If you work your way up, sometimes it goes by half steps as well. Once you get to the largest dot, that will probably give you the largest drop of blood. You do not need any large drop of blood to check your blood sugar with a meter. You just need enough to get on the test strip, and we'll show that to you in the next video. Right now, for just to start, I will start with the mid, which is a 3, which probably will give me a good size drop, but I may need to move up or down depending on the size of blood drop that I have. The next step is to put this aside and get your hands ready so that you can lance your finger when your hands are clean. So I'm just going to use alcohol swabs. You do not have to use an alcohol swab. You can wash them and dry them with soap and water and a towel is fine. But usually an alcohol swab will be fine. Go on the side of the finger. The front of the finger or the middle of the finger isn't going to give you a whole lot of blood, so the side of the finger is the best place to go to get the most blood. And then if it's a little wet with alcohol or soap and water, you can just kind of wave it around, let it dry, or you can wipe it off, it's fine. So now your finger is ready. Your lancing device is cocked and ready to go. It's spring loaded. Your finger is clean. You've got the setting on the right setting, and you want to hold it so that your thumb is usually on the button that is going to release the lancet inside, and you want to poke it on the side of your finger. And one suggestion I have, so that you feel the pressure more so than the poke, is to put as much pressure as you possibly can on your finger with the lancing device pushed down, so that you'll feel the poke less. So once you've got your lancing device cocked and ready to go, you haven't poked it, you've got the lancet in there, and you've put it on the right setting. You put it on the edge of your finger and press down hard and press the button. As you can see, I got a little bit of blood, not too much. You don't need a whole lot of blood. You should always wipe off the first drop. Always. You should never, ever, ever use the first drop of blood. Why? Because it will cause you to get a measurement on your blood glucose machine that is not accurate. So you should only take the second drop. Once you've wiped off the first drop, you can squeeze it a little bit. Sometimes there's not enough blood that comes out, so don't squeeze it directly on the end of your finger. What you should do is you should milk your finger, either by holding it down and pushing downwards, and all you need is just a tiny, tiny drop of blood. So I'm getting a tiny drop of blood. I've already wiped off the first one. This is the size of the blood drop that you need for most blood glucose machines. You do not need anything more than that. And when you're ready, you can take your blood glucose machine, put the test strip up to your finger, and be able to have read your blood sugar reading. Now that you've lanced your finger using the lancing device, you can put direct pressure on the place where you poked your finger so that it will stop bleeding. And likely it'll stop bleeding within a few seconds to a minute. You can keep direct pressure on it, either with the tissue or with a cotton ball. Once you're done, you now have a lancet that has been spent, meaning you can't use it again, or I wouldn't use it again, because diseases are communicated through blood. So I would get rid of the lancet within the lancing device, and you do it as follows. You've got your lancing device here. You pull off the cap. You can see that the lancet is still stuck with the needle pointing up inside your lancing device. Here is where the cap comes in that you saved from when you peeled it off the first time. Put it over the top so that it is no longer poking you. You pull the lancet out of the lancing device with the cap on it, and you can put it in a sharps container. Sharps container might look something like this. You could also put it in an old liquid, bottle of liquid laundry detergent and pull the cap on it, or an old coffee can, whatever is right. You can bring those into the clinic and we will get rid of those for you. We usually like to have them in a sharps container, but only put sharps, only put sharp items in here. Do not put cotton balls in a sharps container, do not put alcohol swabs in a sharps container, just the sharps. And once you've filled it, you can usually bring it into the clinic and we will give you another one. So you've got your lancing device, you can put back together, you've got your lancets left for next time, and you're ready to go for the next time. Every lancing device is slightly different in how you adjust the depth of the needle, what it looks like, and there is even one that looks like this, which has 6 needles in it. This does not poke you with 6 different needles at a time. It takes something called a drum, and you can advance the drum each time you want to do it. That's another way that some of these work. But what I would suggest, the main things that I'm going to recommend, is that you get familiar with what all the different components are for poking your finger. Make sure that your finger is clean, either with an alcohol swab or soap and water, and dry. If you have trouble getting getting blood out of your finger, before you do so, you can put your finger down and let the blood flow down your arm, and that will allow more blood to pool in your fingers. You can adjust the depth of the needle at the top of the lancing device to give you more or less blood, depending on how much you get the first couple times you've done it. And make sure that you've got a way to get rid of your lancets when you're done, so that you're not throwing them in the garbage so that children or animals get into them. Next time we're going to talk about how to take the next step in this, and how to use the little bubble of blood that you get on your finger and how to read it on a blood glucose machine. But I wanted to point out the proper way to do the lancing first, so that then we can move on to the next step, which is our next video on using a blood glucose machine to check your blood sugar after you have lanced it. Thanks for joining me today. Keep a watch for our next video coming up next week, and I will see you next time. Bye-bye.